As we approach the second anniversary of the beginning of the coronavirus pandemic, many Americans believe we're never going to get rid of it. Joining us now to talk about it all is Dr. Bill Hartman, principal investigator for UW Health Pediatric Moderna vaccine trial. Thank you so much for being with us. Doctor, we got a lot to get to. This is a really startling number. Only 15% say they're going to consider this pandemic over when COVID-19 is eliminated, but 83% say they feel it's going to be over when it becomes kind of a mild thing, which in many regards is now. How do you feel about that?
Well, I do think that COVID, as it stands right now, is going to be with us for a very long time. It's not something that is going to disappear, especially when you look worldwide. There's still 3 billion people that have yet to have COVID or a vaccine. And so this virus has plenty of opportunity to continue to mutate, to change itself, and take on different forms. And so certainly getting it into the realm of mild disease is going to be considered having it under control. And I think that the 83% of people are right on par with that.
The Moderna testing booster to fight Omicron, how much do we think that this could help, that particular boost? Because those have been touted as well as very effective against this particular strain.
Well, I think that this is a really interesting study to keep an eye on moving forward. Both Pfizer and Moderna this week have decided to at least move forward into phase 2 with vaccines that are directed against Omicron. You know, they'll compare it to the vaccines that we have available right now to see if there's any added advantage. But moving forward into next year, the year after that, this is going to be interesting to keep an eye on to see if you can tweak the vaccine just enough, similar to how the flu shot is done, so that it's a one shot a year deal that hopefully can keep COVID well under control.
Yeah, one shot would be welcome for many. And this particularly concerning for some, the FDA pulling the plug on those monoclonal antibodies from 2 different drug companies, citing the fact that they aren't effective against the Omicron variant. I'm speaking from personal experience. I was told that they are effective as long as you get that shot within the 10-day window that you're testing positive in. So how do you feel about that? And if people did get that monoclonal fusion, so to speak, should they be concerned that they had some harm done to them, or is it just kind of a placebo type thing for a kind of a flippant reply to that?
Well, it definitely depends which monoclonal those people are receiving. There is a specific monoclonal antibody that's still available that's extremely effective against Omicron. The traditional monoclonals that we've been using, though, made by Lilly and by Regeneron, there's no evidence that they bind COVID-19 anymore. The monoclonal antibodies are 2 antibodies that are very specific for certain parts of that spike protein on the COVID virus. And so if it can't bind it, if it doesn't recognize it and can't bind it, they're not going to be effective. And so the evidence is overwhelming at this point that those 2 by Lilly and Regeneron weren't binding anymore. And so they weren't doing any harm, but they weren't doing any good either.
So summary, still your best defense in your professional opinion would be the boost, of course, in the vaccines.
Absolutely.
Right.
Absolutely.
Dr.
Get that vaccine, get that booster.
All right, Dr. Hartman, thanks for being with us.
Thank you.